Okay, thank you.
Well, is there any significant, can you find an IL-10 that negates that challenge as well as Treg?
Could you find both?
Yeah.
Yes, you can find both.
Is there any significance to that?
Is there any significance to that? Since, no, here's what I think. Since you have different nutrients that support interleukin 10, and you have different other nutrients that support Treg and function, and vitamin A kind of crosses the borders, and sometimes ginger can do both. But what you find is, because mostly they're different groups of nutrients, a patient could certainly be deficient in vitamin D, creating a need for Treg function, and it could be inflammatory and need for green tea, and have an interleukin 10 problem. So it really kind of has more to do with their nutritional status and possibly their phytonutrient needs. Now, a lot of that, I believe, is programmed genetically. You can do a genetic profile in the immune system, and you can find out that some people have genetic SNPs for producing either pro-inflammatory or anti-inflammatory substances. And I believe I showed you the case before of the patient where I did the genetic profile, and the patient had extraordinarily high Th1 and Th2, and the only thing that was low was the interleukin 10. I think maybe I showed that in an earlier session. How could that possibly be, unless they must have had a SNP for the production of interleukin 10? Everything else was high. So their immune system was cranking out both Th1 and Th2, but the only one that was low, was in the normal range, was interleukin 10. How could that be when all the other cytokines are high, and the one that turns them off is low? Well, I think the reason for that is simply because there was a genetic issue with that patient who had autoimmune disease. And so you can have patients who have different genetic needs, so they could have different nutritional needs, so they could have different usage rates of nutrients, intake or usage. So you could have both. For, you know, one maybe because genetic, and the other because they just don't get enough vitamin D, or something like that. So you just have to follow the guide that the body gives you and use the substances that we test. And I usually end up testing interleukin 10 and the Treg support substance, interleukin 2 plus TGF-beta on everybody pretty much early on in the course of treatment if there's any inflammatory activity. John?
So if the right brain, left brain procedure shows up and interleukin 10 shows up for one of those, would we not have found the hesperidin that way versus what you just did with the adrenal?
Yes, so this is a great question. So shows a lot of insight. So he says, if you find the right brain, left brain challenge earlier on, because we took it out of context, we would have probably already found the need for interleukin 10 and hesperidin. And so we already had this covered. So what happens, however, is you get that cleared on a patient. And there's still maybe layer upon layer of immune system problems, because you don't fix the immune system once and it's better. It keeps changing. It goes in these 5 to 7 day cycles. So you probably would have found this earlier in the patient if you'd done the protocol we're teaching. And now you get down to the adrenal challenge technique and, oh yeah, it's just more of the same. But maybe down the road a couple weeks, after you've cleared the first thing out, all of a sudden what's left is inflammatory activity, and maybe it's less than it was before, but because the hypothalamus is so sensitive to it, because of the thin blood-brain barrier, maybe now it shows up as the immune system changes. So you can pick this up later sometimes if the other parameters before it in the protocol are back to normal.